Good afternoon. Welcome to the special meeting of the BOCC to address emergency management related to COVID-19 and the local state of emergency. Thank you all for joining us. And rather than offer many remarks at this point, I'd love to get a roll call vote. A roll call.
Good afternoon. Chairman Miller is absent. Commissioner Hagan?
Here via phone. I don't think my video is working.
Thank you. Commissioner Kemp? Merman?
Here.
Overman?
Here.
Smith?
Here.
White?
Here via phone.
County Administrator Wise?
Here.
Thank you. You have a quorum.
Excellent. Thank you very much. I appreciate that. We have 20 minutes set aside for public comment and 2 minutes per speaker. Please remember to be respectful of the process and not, I don't know the actual language that Commissioner Miller uses, but we're looking forward to hearing your comments. And the first speaker is Andrew Otero.
Yes, good afternoon. My comments were just about the state of emergency. I read the statement that effectively the March 12th order is continuing. Just want to know, based even on your data today, with a death rate by the math of 0.5%, why it should still be in order. What the measure is, what information is going out to the county to update them. For example, letting them know the effectiveness of what they're doing. But overall, it does not seem that a state of emergency is that's the right phrase, and it shouldn't be enforced.
Thank you, sir. Appreciate your comments. The next speaker is C. Burt.
We hold these truths to be self-evident that all men are created equal, that they're endowed by their Creator with certain unalienable rights. Among these are life, liberty, and the pursuit of happiness. But to secure these rights, governments are instituted among men, deriving their just powers from the consent of the governed. That when a long train of abuses and usurpations eventually is designed to reduce them under absolute despotism, it's their right, their duty to throw off such government and to provide new guards for their future security. In this spirit, Article 1 of the Florida Constitution affirms the inherent political power and rights of the people. Article 4 specifies the power of the executive. The phrase executive order appears only twice in the Florida Constitution, in Article 4, Sections 7 and 8, for suspending state officers and granting clemency. Allowing the governor to enact or repeal laws by decree would make him a dictator. Article 4, Section 1 instead requires him to take care that laws be faithfully executed, like Chapter 876, which outlaws the wearing of face masks, especially to terrorize and intimidate those who don't wear them. The governor's and commission's powers do not include usurping the people's rights to liberty, property, industry, happiness, religion, assembly, work, due process, or contract. As intellectual C.S. Lewis explained, of all tyrannies, a tyranny sincerely exercised for the good of its victims may be the most oppressive. It would be better to live under robber barons than under an omnipotent moral busybody. The robber baron's cruelty may sometimes sleep, but those who torment us for our own good will torment us without end. They do so with the approval of their own consciences. This very kindness stings with intolerable insult. To be cured against one's will in curative states which we may not consider as disease is to be put on a level of those who have not yet reached the age of reason, or those who never will, to be classed with infants, imbeciles, and domestic animals. Stop usurping your powers. Stop trampling our rights.
Thank you, Mr. Burt, for your comment. Your time is up. The next speaker is Carolina Ossenberg.
Yes, good afternoon. I'm glad you are present to hear what you have done to this county with your emergency orders. You have caused an economic disaster. You have caused unemployment to be at an all-time high. You declared businesses and jobs to be non-essential. Who are you to decide what is essential or not? Every business is essential to its owners, employees, customers, and suppliers. Your job seems non-essential. You have caused an increase in domestic violence due to stay-at-home orders. You are causing starvation. With no money coming in and interrupted supply chains, more people will die of starvation than of a virus with a 99.996% survival rate. You have put so much financial and emotional stress on people. It has caused an increase in suicides and drug overdoses, while you have limited the accessibility to mental health care providers. You have caused an unnecessary fear in children that will traumatize them for life, all while demanding social distancing so much that having not been taken as a criminal offense. You've isolated the elderly in nursing homes from their families. No human touch is allowed, which is a basic need for dementia and Alzheimer's patients. They are dying of a broken heart. You have caused delays in medical care to so many, we will never know how many will die because of your order. Lastly, the decrease in tax revenue to the county, which will lead to cutting expenses. One of the first to do is cutting your $100,000 salary and your staff. The job performance in real life would lead to termination. Something thousands in the county have a willing to do. You would mean nothing. They can make excuses for us commoners. If you want to enter necessary mass, I want you to enter necessary mass. We will not forget. We will not forgive. We will be back. Expect us. End the tyranny today. Tyranny for the children. End the tyranny today.
Our next speaker is Diana Klein.
Yes, hi, this is Diana Klein. I'm calling on the Hillsborough Board of County Commissioners to completely withdraw, rescind, and allow to expire the state of emergency order in Hillsborough County effective today and get our county completely back to normal business, because the recovery rate of infected individuals, as shown on the board's dashboard, is over 98.5%, which reveals that the coronavirus is nothing more than a common cold or flu infection. Viruses have been around since the dawn of time, and since the dawn of time, there's always been a remedy for any virus that emerges in society. The remedy to fighting off these foreign organisms is to make sure you have equipped your immune system with plenty of vitamin C, D, and zinc in your bloodstream. Everyone can build up their immune system by eating plenty of fermented foods and drinks, as well as consuming raw nuts, bone broth, raw apple cider vinegar, unfiltered honey, eggs, mushrooms, and many other raw foods. Ditch the processed foods and fast food places. These are toxic to your immune system. Coronavirus is simply not the threat to the masses as the mainstream media has portrayed it to be with their intentional fear-mongering for their political agenda. There is an extremely low number of people who are susceptible to getting any serious infection with the virus, which is why the state of emergency order needs to be rescinded and allowed to expire immediately. There is no reason for anyone to fear coronavirus or any other virus. Do not renew the local state of emergency order in Hillsborough County. All the stats reveal that all the numbers are going down. At the very least, you need to modify the order to remove the mask mandate, because masks are useless. For God has not given us a spirit of fear, but of power and of love and of a sound mind. 2 Timothy 1:7. Thank you.
The next speaker is Mary Wells.
Mary Wells. Last week, the CDC quietly updated the death count of COVID-19 to admit that only 6% of the 161,392 deaths at that time recorded in the United States actually died from COVID. That's 9,682 deaths. In a country of 327 million, that's 296 10,000ths of 1%. The other 94% had 2 to 3 existing comorbidities that actually caused their deaths, and 148,083 of the 161,392 deaths, 90% were over 55 years of age. So of the people who died, 94% died from serious illnesses, not from COVID. And the other overwhelming majority were elderly, too. 9,682 deaths in a country of 327 million. That's 296 10,000ths of 1%. There is no pandemic. It's time to take our lives back. This current report proves there is zero justification for keeping this order in effect beyond this meeting. Thank you.
Next speaker is Michael Bishop.
Good afternoon, everyone. My name is Michael Bishop. I am a lifelong resident of Hillsborough County, and I am speaking in favor of continuing the mask ordinance. I base that on Dr. Holt's assessment of the current data. 2 weeks ago, in a public school board meeting, an email between he and Superintendent Davis was shared by a board member in which he stated that the data supported the school's opening plan. We can argue whether or not if that was correct or not, but the point is that the plan included mandatory masks for all staff and students. It was based on roughly 50% occupancy and social distancing and the other things. I do not see how we as a county can differ from that assessment. I would certainly encourage the board to inquire as to what metrics were used at that assessment and what other benchmarks we would be looking for to change those interpretations of the data. So again, I'd just like to encourage that we look at the actual information that is shared by the medical professionals that are available and make rational decisions based on that. I appreciate your time, and I would also like to thank your staffs for everything that they have done. I'm sure that it's not unlike what our state legislatures have experienced over the past 6 months, and I would just like to make sure that they get a public thank you for all of their hard work too. Thank you, and I look forward to hearing the rest of the meeting.
Thank you, sir. Has Amanda Carranza checked in or called in?
Commissioner, this is Glenn with Hillsborough Television. Amanda has not checked in.
Okay, that was our last speaker that signed up to speak for today. Our next item on the agenda is the emergency management update by Timothy Dudley. Mr. Dudley.
Good afternoon. All right. During this operational period, we continue to focus on community testing and also the support of our active operations and logistics, alternate care sites, as well as any response to any unmet needs throughout the county. Last week's daily test collected reflected a slight uptick. Sites also continue to operate at 20% of their capacity. Logistics, we have no PPE or testing kit shortages at this time. We have 1 guest in quarantine, 3 guests in isolation. The transitional isolation site, we are assessing the current status of the site to develop a full demobilization plan, which will allow us to officially return the site to its original condition and reconstitute any supplies and assets that we have deployed. As we continue to look at this operation, as well as the Florida Department of Emergency Management, we will continue to assess where we're at during this emergency and continue to right size to make sure all resources are being used efficiently. We continue to see community testing by our partners taking the bulk of the testing, and we appreciate that. And we'll continue working with our partners out in the community as we look at right sizing testing in the future to see how we can continue to transition testing back into our healthcare system. We'll continue to adjust testing capacity in response to increased testing demand and as PPE supplies and staffing permits. This concludes my update. Any questions?
I'm not seeing any questions as of right now. Mr. Dudley, thank you very much for the hard work that you're doing and your entire team. Many of our staff members are working at an incredible rate to serve our citizens well, and your team is doing a marvelous job. Thank you very, very much. Message to the public, please, if you have any symptoms whatsoever or appear that you have possibly been exposed, it's important for you to get tested so that we make sure that you are aware of your ability to protect yourself and others. And so just to remind folks that we still have capacity on testing and that is available to you at no cost. Next item on the agenda is public health update and epidemiology review by Dr. Douglas Holt. Dr. Holt, you're recognized.
Good afternoon, Madam Chair, Overman, and Commissioners. This is Dr. Douglas Holt, Florida Department of Health, Hillsborough County. Today, we're going to review the epidemiology and hospital data. I'll share my overview, some observations, and then Mr. Wagner will walk through our dashboard. I'd like to, we also have a presentation from Dr. Michael Croner. He was trying to work us in and his patients. I would ask, Dr. Croner, are you on? I know you're valuable. If it is, I'd give you a chance to go first.
I am on, if you can hear me, but I can wait till after you're finished with your presentation.
Okay, I just know your time and patience. I didn't want, okay, then I'll proceed with ours and then you can follow. That'd be great. Thank you, sir. First slide for, please. Okay, as you can see, our 7-day rate per 100,000 is now at 83. That's a 20% reduction from our where we were last week. So we're starting hopefully to continue the downward trajectory. When you get to the dashboard, you'll notice the total number of cases we have is just under 39,000 as of reported through today. These are the number of people who've been tested just once, or not multiple counts, and they would have been tested by PCR antigen, not the antibody. We look at our real-time current data, 7 to 14 days, sort of really telling us what we're seeing, how much virus is in our community being spread. And overall, we're seeing some good news. Our number of new cases over the past 7 days averaged about 175 per day. Bit concerning, as you'll see, is our positivity rate remains flat around 6%. Fortunately, as we see fewer cases, there are fewer admissions to the hospital, and we don't have as many hospitalized patients with COVID. Our overall bed and IC occupancy is less than 80% per Tampa General data, which is again also stabilized or flat. And deaths, 573, that has also slowed. Next, actually, okay, we'll stay there. When you look at the dashboard, Mr. Wagner is going to, at the very end, I would call your attention to the case data by school age. We've seen a bit of an upward trend among our 15 to 19 and our 20 to 24-year-olds that we noted last week, but that has continued. There was a particular day that we saw an especially high spike that was associated with some targeting testing efforts that we were a part of. This trend of these age groups has been noted nationally and is Florida as well. As we see these 19, particularly to 24-year-olds, increases as they've opened some of our colleges and universities. Next slide, please. Looking at ourselves over time, you'll see that at the far right of this slide, the data that previously we looked like we're flattening, a bit of an uptick. We had a bit of a hump, has now flattened out and is starting to see hopefully a downward trend that may be slow. I do not expect the downslope to be very steep, but hopefully it will gradually continue as we approach the yellow zone, if you will. Next slide. So regionally, looking at where we are, we still remain just above the yellow zone, if you will, The CDC terms the yellow zone we're heading towards as a place where there's moderate to mild community-based transmission, but there is still substantial and sustained transmission that can occur, and the risk for being exposed, especially in communal settings with gatherings, whether it's schools, workplace, and other recreational, will continue. And we have the potential, even at the yellow, to have an increase of cases. If you notice, we are trying to join our counties, neighbors, Pinellas, Manatee, and Sarasota. Statewide, these numbers show similar trends as other counties that have been particularly high, such as in South Florida, have actually dropped significantly and are also approaching the same. So this is really a statewide picture. Next, and so my summary really is, over the last 7 days, we have improved, but we still have a long way to go. We are entering really a very critical period. 3 weeks ago, we opened up our universities. 2 weeks ago, our K-12 school, and we've 1 week ago had our Labor Day. So again, continue to ask over our next 2 to 3 weeks that we all do our best to keep practicing all those habits. We need to protect ourselves and others, avoiding those 3 C's: close contact, crowds, and closed spaces, and wearing face masks, especially indoors. I certainly know it's hard to keep up these habits. Occasionally, I'm not perfect either, but we all must do our best. And as long as we all do that, I'm hoping to see these numbers continue and the virus get sustained and controlled, which is our next goal once we join the yellow. Mr. Wagner, can you now go through the dashboard for us, please?
Yes, sir. Again, good afternoon, Commissioners. Kevin Wagner, Business Analyst, Healthcare Services Department of Hillsborough County. I will present the publicly available Hillsborough County dashboard. As Dr. Holt indicated, we are under 39,000 total confirmed cases and an estimated recovery nearly 32,400. So again, the 98% recovered estimated rate. Our testing per average on the second row is continuing to flatline or decrease. On a 14-day average, we're looking at 20,000 tests that are completed in that time frame for each week. So we'll talk about that later on the presentation. Our 14-day positivity, as indicated by Dr. Holt, has slightly flattened to 6.7%. As you can see, the previous 7 days ago, it was 6.8%. Previous 7 days ago, prior to that, 7.3%. So again, it's trended downward, but the last 2 weeks have shown a flatline approach. The hospital utilization, as indicated through the TGH data exchange, everything is in the green level right now, trending downward or flat, ensuring continual capacity in our hospital setting. With regard to our daily caseload of new positive cases, I'll speak to the bottom graph. The 14-day average is 185, and the 7-day average is 160 on those respective counts. I looked a month ago on those respective counts, they were 250 to 300. So in about a month, it's gone down 50% on a 14 and 7-day average in positivity calculations. Again, speaking to the hospitalizations on slide or page 3, again, we do see a downward slope on the data exchange, or roughly 182 hospitalized census on a 7-day average for inpatient and ICU utilization, and the admissions on the right-hand side around 14, 15, 16 on a 7-day average right now. So the trending has gone down as indicated. The 2% is estimated of the population that's has a positive confirmed cases, specifically 2.6% of the 1.7 million citizens in Hillsborough County has been confirmed positive. Looking at our testing per week on a 14-day average, again, it's slightly downward. On the chart at the bottom, the last 4 weeks, we can see a significant decrease of 20,000, 22,000, 18,000, and 21,000 tests in a week. So that kind of makes up the average of 20,000. But again, the last 4 weeks, we have seen a significant decline in the test reported through the FDOH. As Dr. Holt indicated, this is the newer slide, which it includes the data by school age groups. Each line represents a respective age group. I'll speak to the far right-hand side. As you can see, Dr. Holt indicated a spike that was due to targeted testing in that age on that day. Again, 15 to 19 was a quite high number in that age group, again, due to targeted testing, as well as 20 to 24. The value in the daily testing, we can see in immediate spikes, but it doesn't show us trends, but it does show us immediate spikes, just like indicated before. It's the stock market where it goes up or down. So these areas of concern, our spikes, are ones that we have to continue to monitor. The bottom chart, again, helps with the trending, while the previous is looking at spikes. This provides us trending on the bottom chart. As we can see, the groups of 15 to 19 and 20 to 24 on 7-day case totals, that has trended somewhat upward or a somewhat up flattening approach, while the other age groups have continued a downward trend. So again, from a monitoring standpoint, as FDOH indicated, these are the groups that we need to continue to look at. And I'll stop there. Thank you.
Thank you, Mr. Wagner. I truly appreciate that. Dr. Holt, would you like to introduce Dr. Croner if he's still available?
Yes, Dr. Croner is a practicing family practitioner here in Hillsborough County. He's also the president of the Hillsborough County Medical Association, and going to talk about experiences with community physicians and caring for their patients. Dr. Croner?
Good afternoon. Can everyone see me and hear me?
Yes, Dr. Croner, you're recognized. Thank you for being here.
Good. All right. Thank you for the opportunity to share with you today. I am speaking on behalf of the Hillsborough County Medical Association, and many of the members I have been able to speak with as I give some of my data. I don't have a PowerPoint presentation, but I do have about just 5 to 10 minutes of giving you some of the key points I think that you'd be interested in. Like everyone I'm speaking with and every other type of business in the United States, the physician community also had to evolve very rapidly out of necessity and changing the way that we do business. Had to do it for 2 reasons. Number one, to stay in business. We knew our overhead was not going to go down. In fact, with the extra expenses of personal protective equipment, expenses have often gone up. We had to continue seeing patients and trying to bring patients in to have revenue. The second part of evolution was to be able to provide the necessary care, but in a safe environment, safe for both employees and for our patients and the community. So let me talk about the business side of things first, because in the surveys that I both read about for the state of Florida and a personal survey that I've done by calling my colleagues, there's a broad spectrum of things. In general, though, anybody who is employed who was working for large corporations, I have to say and give our medical systems kudos for providing protection and making policy and allowing finding PPE to absorbing the loss of revenue to minimize patient-employee layoffs and furloughs. The large corporations have done a great job of this. On the other hand, smaller private practices, self-employed physicians had a little bit tougher time. They don't have the cushion that they can to absorb, much more of more than a 30-day downturn of revenue. Larger corporations can have a little bit more that they can absorb. Some colleagues who were in their end stages of practice have chosen to use this as a time to close their doors. certainly any other smaller self-employed physicians, they're all having to tighten up their belt. Many have used furloughing and moving full-time people to part-time. One thing one of the physicians wanted to let me know is let the commissioners know is the extra expense of the personal protective equipment. In 1-2 physician practice, to be able to cover them, their employees, and the patients that would come to see them, that's an additional $3,000 per month on average that they're spending. And that basically comes right down to their bottom line. So they are looking, and with the help of the Hillsborough County Medical Association and our staff there, we were able to join a co-op and provide much needed PPE equipment at a very good rate for these people who needed it. In a survey done by the Florida Medical Association, as of early May, there was a 40 to 50% drop in volume coming into physicians' offices, and a greater than 60% drop in revenue, because not every revenue is based on patient visits. A lot of it's based on ancillary revenue also, and when patient volume goes down, ancillary volume goes down also. Specifically here in the county, that amount of volume pretty much is typical for most practices. There has been some practices for a short period of time had to close altogether until they could get the PPE, until they can get online with telemedicine, of which I'll go into more in just a minute. Or there's one large orthopedic group that actually had to close their doors for 2 weeks because of COVID positive employees and physicians, and not knowing exactly what to do. They just did the safe thing, but they termed their experience catastrophic as far as revenue goes, because even once they got the doctors healthy, the staff back in the offices, then came the closure of all the elective surgeries in the state. And a lot of orthopedic cases are elective, and they are still below 80% of their usual caseload. As of now, though, most practices are about at 80% of their pre-COVID levels. Of course, we're working towards more of that, and with the help of, by the way, that's with the help of telemedicine, of which I'll now evolve to the second part of what we had to evolve. We had to quickly be able to provide safe and effective care, and telemedicine has seen a greater than 1,000-fold rise in the use. In June of last year, 0.13% of all medical claims were based on telemedicine visits. As of May this year, 15% of claims are based on telemedicine visits. That's about 1,000-fold increase. Telemedicine is here to stay. It certainly provides a safe, convenient way for patients to be seen. Time will tell, as more studies are being done, is it as effective, and is the quality of care good for telemedicine? I think that's a topic that we're going to be looking at to make sure that this is a continual viable means of providing care. One thing that we've done also, and hospitals do this, ancillary providers of radiology companies, dialysis, physicians' offices, we're doing tons of screening. We are, every day we're screening people who call for appointments, the necessary questions to make sure they're not actively ill, and if they are, to stay at home or to go somewhere and get tested. We're daily screening our employees with both questionnaires and temperature checks twice a day. Of course, every corporation and every doctor's office may be doing it a bit differently, but there hasn't been anybody I've spoken with who's not doing some form of screening ahead of time with their patients and then daily with their employees. So one take-home message we'd like the community to be aware of is that hospitals, ancillary services, physicians' offices are safe to come to. We clean and make the hygiene value levels higher than we ever used to, and we're doing our best to assure that no employee with illness comes to work. And as we get that message out and patients feel more comfortable coming back to the office, hopefully our levels will rise up to the pre-COVID levels shortly. I want to remind the community that the reason why the elective surgery were put on hold was to save room and staff and space for in case the pandemic needed more hospital resources. Now, as this presentation prior to me showed, those resources are available and safe to go to. And anybody who has been putting off elective type procedures like screening colonoscopies, mammograms, dermatology visits to see their skin doctor, no longer need to put that off out of fear of getting infected in a doctor's office. They're open, they're ready for business, and they're doing everything they can to keep the community safe. As I mentioned, telemedicine is here to stay. The reason why it was at such a low rate before is because Center for Medical Services, or Medicare, had put such restrictions on what it took to be able to bill legally for telemedicine. It was mainly meant for rural communities, but even in the rural communities, those patients had to go to a site that had a computer system that was HIPAA compliant, and then all the necessary dialogue had to take place, the documentation had to be done. Well, back in mid-March, when the government released those restrictions, allowed people to use their own computer from home for us to be able, as physicians, to use multiple platforms, not all of which were HIPAA compliant, but giving the patient choice of whether they still wanted their visit done by whether it be Facebook or Zoom. And then there's many other, those are just two platforms that are not HIPAA compliant, but then choose a multitude of other platforms on the computer that provide telemedicine visits. So personally, I believe it is certainly a safe way of giving care, but not necessarily a better one, because it definitely decreases the patient-to-physician direct contact. That's important in a relationship. Also, as a physician, you certainly miss, because you can't see, much of the nuances that come in a physical exam, whether that be a lump you see on someone's neck, or the way that their gait is, or their affect is, or say a skin lesion. Those small things that can be important aren't picked up in a telemedicine visit. So I, for one, and many physicians speak that we hope it's not going to be a thing in the future that's what everybody wants. It should just be as an opportunity, as an alternative. Also, one thing that Medicare did was that they made the payment for telemedicine equal to in-office visits. Prior to March, the payment schedule was about 1/4 the level of an in-office visit. And that made it a very inefficient way to see patients, because there is a cost involved. There certainly is time involved. And to not get paid at a good rate was one reason the physicians were not migrating to it. The restrictions have allowed payment equitabilities to occur, and the private insurers have fallen in line also, paying for the visits equally. So one thing we say is from the physician community is we certainly hope these restrictions will stay relaxed, payment equivalency will remain, and patients can continue to do their visits from the comfort of their home and not have to go to a set facility with only HIPAA compliant type of computer systems. With that, I'll rest and ask if anybody has any questions.
Thank you, Dr. Croner, for your report. That was very informative. We did several months ago actually ask the state to take a look at the telehealth reimbursement rates and urged some improvement there so that physicians could actually see their patients safely. So I'm glad that that's worked out very well for you. I don't see any questions from the board. And with that, not seeing any, I would like to invite Christine Beck to address the county attorney update.
Yes, good afternoon, board members. Christine Beck, County Attorney. You have before you, consistent with Florida statutes, the draft order, which would extend the local state of emergency for an additional 7 days. And at this time, Madam Vice Chair, it would be appropriate to consider a motion relative to that order.
Do I have a motion?
So moved. Second.
Motion by Commissioner Kemp, second by Commissioner Smith. Any discussion? Please take the roll. Roll
Overman,
call vote, rather. Yes.
Hagan,
Yes.
Kemp,
Yes.
Merman,
Yes.
Smith,
Yes.
White.
Yes.
Motion carried 6-0.
Excellent. Thank you very much. The next item on the agenda is board discussion. Are there any items that the board would like to discuss?
I do.
Commissioner Merman, you're recognized.
I'm trying to get my hand up. I guess I'm going to go back to comments I've made for the past meetings about, and I guess it's for Dr. Holt. I think we're in kind of a situation here where the numbers are starting to go down significantly, though I know that we're being cautious because of school openings, and I think that that is very appropriate. But at some point we have to kind of have an end game to what this is, where we're headed with this, and when we're going to try and get our county back to any sort of normalcy going forward. So I guess it's probably not a question, it's more of a statement. I just feel that we need to start looking at this. And as we get these reports, especially as we wait for the school openings to take effect and any significant increase from the openings, which we did see a bump, and that is concerning because we definitely want our children to be safe. But I guess it's just, I think we have to start thinking about when we can really get ourselves back to normal and get our businesses reopened normally and just moving forward, get people back to their jobs and go forward. So it's something I think we all have to start thinking about, and maybe staff or have some expert come in and give us some suggestions about what they think would be, I guess the right, at what numbers are we going to use to make these changes? And I think we've all stuck with the 5% positivity rate, and we have not gotten to that point yet. So it's not today, but at some point we have to say, when are we going to make changes and get back to normal? So that's my comment.
Thank you, Commissioner Merman. Dr. Holt, would you like to respond to some of that before I call on Commissioner Kemp and Commissioner Smith? Commissioner Smith?
Yes, this is Dr. Holt. A lot of this has to do, I guess, with the governor going to phase 3. We're not happening yet. So that's one area that, and as far as getting back to normal, I think that's the message is social distancing, behaviors, keeping away from gathering is the new normal. I would encourage that and continued face masking as appropriate. I think as far as policy changes and specifically opening changes, I guess I'll take the lead from the governor there. I'll stop.
Okay. No, that's a great suggestion. And I definitely think social distancing and especially crowds are something that even going forward, we have to constantly be vigilant about. So thank you.
Thank you. Commissioner Kemp, you're recognized.
Thank you. I just want to make sure that we don't send out any messages that now is the time to go back to what it was before the pandemic. Today in Florida, they reported 378 deaths. It's the most we've ever had reported in a single day, ever, by 100. And I know that we had a 3-day weekend with lower numbers of reports, but yesterday, when we typically have lower numbers, we had 202 deaths. Our positivity rate has been stalled, as we heard. 7 days ago, it was 6.8. Now it's 6.7, nowhere near 5%. And I will say that New York State, with the problems they had, are down to 1% positivity rate. We are not at a place where we should be sending a message to the public or suggesting that there are to let off to do something different. We need to be wearing our masks. We need to be keeping away from crowded places. We need to do very strong observance of all the messages we've been told. And as well, we will have, I feel certain, and we saw those numbers going up for 10 to 24-year-olds, which is no surprise. We've been told it's very dangerous when we start schools with the great rate that we already have. We've seen all over the nation that schools are shutting down, that they're having issues and problems. So I think we need to give the message to the public. Thank you, thank you, thank you. I think that is really what is doing the great work of bringing these rates down, keeping people safe, hopefully keeping people away from getting very ill or dying. Or our loved ones, our family members. It's no time to talk about how we get back to where we used to be. This pandemic is still raging in this area among us, and I'm really looking forward to getting down to less than 1%, like New York, and where we can start to really talk about how we can look at opening up things and, where we can be for, I know I'm as anxious as every single member of this board, and I'm sure every single person in Hillsborough County to have life more like it used to be. But we are in this very dangerous situation. We have just added to it by opening our schools at how we have. And so it's time for us to keep moving forward, and I'm grateful to see the numbers stalled, even if they're stalled at a very high level. We should make no mistake about that. 6.7, 6.8, those are high levels. So I hope we can continue to work at bringing those down and stay safe for the months to come.
Thank you, Commissioner Kemp. I appreciate your comments. I don't see any other hands, and I'd like to compliment that being said. I have a lot of friends and a lot of family and a lot of folks in my life, and I've never experienced a week like I have the last week with 6 deaths of people that I know. And now, granted, it's just one person, but those are 6 people. And I do know of a family who sent their child to school, and a family of 5, and now all 5 of them are wrestling with COVID. And it's impacting their work, it's impacting their school, it's impacting potentially a lot of folks' lives. So while it is troubling that we are not back to normal, and it is difficult for those that cannot return to work, we have a lot of things in place right now that are starting to work. The programs to help our daycares open, the programs to help our businesses reopen, the programs to keep our citizens that have difficulty with going back to work to have their rent and utilities covered while they adjust to the restrictions that are necessary for them to be safe in their communities and at their workplace. And I do want to thank all of our citizens for taking on the American spirit of protecting your neighbors and yourself by wearing masks and social distancing and washing your hands and being very cautious. Dr. Holt, I'd like for you to actually share with us a little bit about the largest group of folks that are gathering of late, and give us a little bit of an update on the testing that is going on within our school systems now that our kids are back to school and the teachers are back in brick and mortar. Can you help us with a little bit of an update on that?
I don't know how specifics you are looking for. You know, we've partnered with our school districts. We've opened, they've opened, and we've been working through some cases, not surprising, at our schools, and systematically going through to determine who might have been exposed at school and excluded them. We're looking critically for questions about where the child was infected and did they infect anyone either at school or at home. And those are kind of our area of focus. We've not, you know, not quite a week or two, not quite 2 weeks that we have. So we don't have those secondary cases. I wouldn't have expected to see them at this time. Overall, I think the school district has done a remarkable job, and you know, I applaud their transparencies about sharing with the community just what's going on. So.
Excellent. Excellent. Thank you. That's very helpful. I don't see any more hands. Commissioner Kemp, your hand's still up. Do you have another comment? Okay, great. Thank you very much. Well, thank you all for being here today. We have our emergency order is still in place. Still wash your hands, keep your distance, wear a mask when in public or where you're unable to distance or inside of a business. And with that, I will adjourn the meeting. Thank you.
Welcome to Open Voice Audio Services. Please enter your conference room number followed by the pound or hash sign.